This is Dr. Ranjit Rajput, physician and intensivist practicing in Chalisgaon since more than 10 years. Today we are going to discuss pulmonary fibrosis linked to gastroesophageal reflux disease. Hello everyone and welcome. Today we are exploring the connection between two significant health concerns, the gastroesophageal reflux disease and the pulmonary fibrosis commonly known as a PF. First, let's talk about the gastroesophageal reflux disease. The gastroesophageal reflux disease is a long lasting condition in which stomach acid frequently flow back into esophagus, causing symptoms like heartburn, regurgitation, and the discomfort. And the GERD affects large population of the patient, can lead to complications if left untreated. This acid reflux can irritate the linings of the esophagus, your food pipe, and over a time cause damage that may extend beyond the digestive system. And the pulmonary fibrosis, on other hand, is a serious lung disease where there is a scarring of the lung tissues. Over time, this scar makes it difficult for lungs to function properly, leading to breathing difficulties, tiredness, in advanced cases, or severe breathing issues. Pulmonary fibrosis can result from various causes, including genetics, environmental factors, and other underlying conditions. So, what's the connection between the gastroesophageal reflux disease and the pulmonary fibrosis? Well, the studies indicate that there is a significant overlap between two. People with the GERD are often more likely to experience the lung issues due to aspiration, inhalation of stomach acid into lungs. This repeated exposure to acid can contribute to inflammation, even scarrings within the lung tissue, and the possibly worsening of the pulmonary fibrosis. Patients with pulmonary fibrosis often experience the increased GERD symptoms like acidity, reflux, breathlessness, chest heaviness. This may be partially due to their body's weakened states and the reduced lung capacity. When the GERD is present in a patient with the pulmonary fibrosis, progression of fibrosis can accelerate. Got it? And making it essential to manage the symptoms of the GERD effectively. One approach to managing the GERD in patients with the pulmonary fibrosis involves the lifestyle changes. These include avoiding the certain foods which can trigger the GERD, like a spicy food, acidic foods, caffeinated drinks, alcohol that can worsen the reflux. Eating smaller meals, avoiding lying down after meals, and elevating head while sleeping can also reduce the acidic reflux episodes. So, in short, we should take the small meals. Do not lie down immediately after the food or sit for 30 minutes and drink the water after 30 minutes. Avoid the alcohol, spicy foods, the breads, and everything. And they are also having the underlying the disease of the pulmonary fibrosis. So similar approach we used to give with the medicines which can reduce the acid secretions and the dietary and the lifestyle modification as we are discussing during our initial presentations. Now we are moving on more severe cases of the gastroesophageal reflux disease. The medications such as proton pump inhibitors or H2 receptor antagonists may be prescribed to reduce stomach acid production. In some cases, surgery may be considered, especially if GERD remains uncontrolled. And it is very important for people with the pulmonary fibrosis and GERD to collaborate with their healthcare providers to develop tailored management plans. Early interventions and the management of the GERDs can potentially slow the progression of the lung damage in the patients with the pulmonary fibrosis. So after these presentations, we will conclude with above these discussions that the gastroesophageal reflux disease and the pulmonary fibrosis are the both common, both complex conditions with huge impact on the quality of the life. Understanding their connection between empowering patients and healthcare providers to make informed decisions that could improve the health outcome. Thank you for joining us today to learn more about this important topic.